Next, I would like to welcome our industry speaker and a presentation by Dr. Sayf Abdelrahman, the Chief Executive Officer, Topmed, Health Catalyst Inclusive Service Partner, MENA region. He's going to give a presentation on the topic Secrets of Profitable Hospitals. Indeed, a very interesting selection of the subject, and we would want to know what exactly is the secret for making the hospitals profitable, because hospitals definitely have to make our ecosystem future ready and our... So Dr. Sayf, just a quick brief about Dr. Sayf. Dr. Sayf is a well-nominated in creating unique profitability management approaches in healthcare. With over 20 years of experience, he had remarkable experiences in managing startup corporations and leading organizational transformation in different well-known healthcare institutions. So it would be a great honor to hear Dr. Sayf as he presents. And I request all the delegates to please settle down and do the networking after the presentations. We would be having a brief tea break and networking. So I request all the delegates to please settle down for this presentation as Dr. Sayf presents. So over to Dr. Sayf.
Thank you. Thank you for your nice introduction. I know we are closer to the end of this event, which is really a great event and a great organization. I would like to have a very short executive talk with you guys because I know we are all tired, okay, and I don't like to make any burden, okay. So I hope I will have a light talk. Okay, until they upload my presentation, we can have a light discussion together with the interactive talk, okay. May anyone help me to connect with the audience, with the mic? Hello? Yes, excellent, excellent. Someone from the organizers? Yes, yes, please. Okay, just give it to him. Okay, I have a question. I have a question to the audience. The subject, the topic of my talk is about profitability, hospital profitability. Okay, secrets of hospital profitability. So I have a question, and I need to get the feedback of the audience. Every successful business has critical success key factors, okay? So I want you guys to share with me your experience and feedback regarding the critical success factor when we talk about hospital profitability. Is there any idea, thoughts, how the hospital become profitable? Okay. Okay, how many of you work in the healthcare private hospital section? Any of you work in hospitals? Excellent. So, what's your good name, please? Would you give her the mic, please? Please introduce yourself.
Good evening, everyone. I'm Dr. Shilpa from Jahangir Hospital, Pune, India.
Okay.
And I head the operations at my hospital.
That's very great. If I may ask you, doctor, your experience about the topic. Okay, we are talking about profitability. What do you think? How the hospital become profitable?
One is definitely optimum utilization of the manpower by reduction of the cost in the manpower. Second is that can be also because of the topic of technology coming in. Usage of technology, and also one very important thing is the clinical outcomes which help in reducing the ALOS of the patients, average length of stay.
Okay, thank you, doctor. So you think that for the hospital to be profitable, they have to have good utilization of the manpower, right? And they should apply the right technology? Yeah. Thank you. Any other ideas? Doctor, please, doctor. Thank you very much.
So my name is Mohammed Baraka. I'm working as Associate Professor of Clinical Pharmacy. I'm not working in hospitals, but I'm working in the academic side of clinical pharmacy. And I believe cutting costs, by cutting the drugs costs or medication costs and making it cost effective for the patients by following them up, especially remotely using technology, and intervening in a timely manner to prevent complications and to prevent morbidity and mortality, rehospitalizations and that stuff. I believe this will save a lot and make the hospital profitable. We usually forget about pharmacists and their impact in reducing the cost of medications and the waste of resources that could happen in this area. Thank you.
Thank you, Dr. Baraka. So you're affirming that optimizing the cost and preventing medical complications are really attributing to the profitability, right? That's very good. So thank you. Yes, please. Our friend over there.
Hi, my name is Goran and I'm actually from IT industry, but I believe that the business is similar everywhere across the board. So I would say you need to focus on what you are best in. So finance people will focus on cutting costs. Operational people will focus on providing, let's say, customer experience and getting this word of mouth and recommendation as a getting business forward. So I would say whatever you do, you are focused on what you're doing the best and pushing it to the highest level.
Okay, it's maybe you're speaking also about utilization somehow?
I would say, I mean, because I'm not from healthcare, so I cannot say individually. But I guess every operational head will focus on strength of his strength and his team's strength. And then sometimes if you have a finance person coming on top, he will focus on cost. But if you have a doctor coming on top, he will focus on providing better care and getting this, let's say, word of mouth and more business.
Okay, I think your answer is really a kind of diversified answer, which is useful as well, adding value to the answers of our colleagues. So I like to appreciate your feedback all, and from another point of view, I could tell you that there is always something hidden. Okay, so if I would say, for example, if I say cutting the cost or cost optimization, this is really a great initiative. Okay, however, there is something really more important, or I could say it's more basic than cutting the cost. There is something should be preceding cutting the cost. I will ask this question, okay? What is that thing that precedes cutting the cost in healthcare operation? Just try to think. Maybe we can make a price, okay, if someone answered this question. Okay, I have a price, 100 dirhams. Okay?
I would say addressing the market gap.
Market cap.
Gap.
Cap.
Gap, it means providing what is missing.
Yes, okay. Okay, it's not bad answer, but this is not the precise answer yet. 100 dirhams. Before cutting the cost.
I think before cutting the cost, you need to have a clear strategy. Why are you existing? You have a kind of target, you have KPIs to achieve this target, you use the data wisely and you analyze them to have incitable actions in order to improve your care, as my colleague said. So improving care is also important, it's not only about cost. Sometimes you cut cost and this um, uh, can affect the quality of care you are providing, and then you are losing. You are gaining money, but you are losing reputation and marketing and more important things. So it's not just about cost.
Thank you for your answer. Thank you for your
100
answer.
dirham, please.
No, but this is not the accurate answer.
I'm fine with 50. Thank you. Thank you.
Okay, another chance, last chance before I talk. Okay. Please, someone.
Yeah, good evening. I'm Aditya Bahadur from Reliance Foundation Hospital, Bombay,
Okay.
Mumbai. So, to answer your question, one is, of course, the service excellence. Clinical and service excellence would be the, one of the key points. The second is in terms of, that from a ALOS standpoint, we look at in terms of, services within a hospital which are high on ALOS, which are low on ALOS and high on revenue. Mm-hmm. And we work backwards on the utilization of those. Because there are certain price points which, from a revenue standpoint, we are able to achieve.
You're talking about price?
Yeah.
Okay, go ahead.
Because, it is a firm belief that, once you provide clinical excellence, price follows.
Okay, thank you for your answer. You talk about pricing, which is essential for profitability, but how can you make the right price? How you make sure that
so there are two models.
You have profit out of the procedure price, for example?
So there are two models to this. One is in terms of, if you have an exclusive product. When I say exclusive product, it might be a surgery wherein, nobody in the country is doing it. You demand a certain price and people follow because your clinical success rates to that procedure are very high.
Okay, thank you for your answer. And I think the answer to my question will help you in pricing. Too much is essential for pricing. Do you have an answer, Mona? Please, go ahead.
So, data?
Data?
In order to understand, because if you repeat your question.
Okay, data is essential, okay, all over the way. But in order to make cost optimization, in order to make value-based healthcare, in order to apply the population health, in order to make profit.
In order to make any informed decision, we need to understand the data and analyze it.
Okay.
Which eventually leads you to whether it's quality, whether it's service improvement, whether it's...
Okay, you're right, but again, I will tell you the final answer, guys, okay?
No one's going to get the 100, by the way.
Okay, so, okay, before, okay, now the price is 50, not 100. It goes down to 50, because I will make it easier for you guys. Okay, before reducing the cost, okay, you have to have something. You have to have something in your management components. You should have certain strategy. Otherwise, you couldn't reduce the cost. It will be very haphazard and hazardous as well. I'll give you 10 seconds. Doctor, tell me, raise your voice. Thank you. Doctor, your answer is really very good. Okay, I will give you the final answer, guys. In order to reduce the cost, you have to have cost strategy. That's very simple. And the best cost strategy for any hospital is ABC costing strategy. This is what we miss. This is a cornerstone that we really miss in more than 90% of the hospitals. The costing strategy, the costing methodology. So you couldn't say, I will reduce the cost without having such kind of methodology. You couldn't say this, you will make disasters. If you say, I will reduce the cost while you don't have the right methodology, you know what you are going to do? You are just going to fire people. You are just going to reduce the service quality. Okay, so what we adopt in hospital is ABC costing. ABC costing, activity-based costing. And this really kind of methodology is really designed for healthcare because, as you know, healthcare is the most complicated service that could be managed regard costing. Okay, so the activity-based costing is really managing the big overhead or indirect cost that being incurred in hospitals. So the hospital who incurred losses, and there are many of the hospital incur losses in spite of the good quality of medical care, in spite of the high frequency of patient, many of them are, in spite of the high prices, they still making losses because they do not have the basics. Okay. And one of the basics is to have the ABC costing strategy, the activity-based costing strategy, which allows you and enable any hospital and any hospital director to take the right decision and assign and map the right pricing to the procedures. Today, I have some use cases and study cases for you guys to be very practical with you and go to the point in a few minutes. Then I will get your question back, okay? So may I start my presentation? This is actually one of our clients, and this is a study for 6 months, a study about medical consumables, actually. So I need to, yes. This is how to go to the following slide, yes. So look at this slide, guys. Actually, it is a little bit amputated, okay? So you can find the name of the procedure. The first procedure is the rhinoscopy, and the other one is the gastric sleeve, gastrectomy, and so on so. So the first column shows you the consumable costs for each procedure. Okay, in this medical center, okay. So as you see, for example, the first procedure is costing 1.025 million for 6 months. This is the cost of these operations, and the median price of this procedure is 6,700. Okay, the number of cases reviewed based on this calculation is about 130 cases. Okay, so if you can see the opportunity of doing the cost saving here, okay, while making the reference as the median, and I will explain to you right now. Okay, so we can reduce the costs and make cost saving 1.5 million. Okay, if we try to push the consumables towards the median. Okay, so sometimes we use the median, sometimes we use the average cost. Okay, in this case we use the median. Okay, to be more realistic. So if we have 130 cases, so half of the cases are more than the average cost. I'm talking about the cost of the consumables are 7,000 plus. Okay, however, more than 60 cases, like 66 cases are more than the median, and about 66 cases also below that median. So you can set a target. If you don't have a standard in costing, you can start initially by having a target to reach to the average of 6,700 for each case. Okay, so if we go to, okay, as you see, we can have two examples here. We have two examples. The first example is the gastrectomy. The sleeve gastrectomy, the sleeve operation. The second example is the knee replacement, total knee replacement. They are common procedure that being done in hospitals, and big hospitals, especially big hospitals. So as you see the arrows, the black arrows, looking at the median for the knee replacement, for example, as you see, is very low in quarter. So that means half of the cases down the line and the other half of the cases above the line. I will show you. If you are looking for cost saving, you can just try to aim to the cost of the median, which is, for example, 6,000 or 7,000, whatever. Okay. Double-clicking the things. Okay. You have the same procedure. You have the total knee, you have the laparoscopy. Okay, for example, for the laparoscopic sleeve, okay, you have the first section is the expenditure, the cost, and the second section, the second half is the activity count, means the number of patients, number of operations. So you have to click deeper, double-click the figures deeper, and to check, okay, and here, we're talking about 6 cases. So we have 6 cases. 1, 2, 3, 4, 5, 6, and the count of the same 6 cases, 1, 2, 3, 4, 5, 6. Okay. So if you look at the market and the market figures by red, it's really higher expenses compared to the others. So what we do, we have to go into more details to understand why these cases has these such kind of expenses higher than normal. This is what we do. And then we have to have our own committee or our own team. It's not only the finance who are looking to the costing, it's finance, it's the medical department. All of them should be sharing in that activity. Okay, and all the stakeholders. So whenever we have a case like this, okay, we have to look at it, we have to review it with the team, and we have to talk to the doctor, we have to talk to the nurses or the responsible team. Why this case having such kind of expenses more than the others? So if there is a really logical reason, that means we can amend in future, we can improve the performance, we can make cost saving. This is like magic, guys. Whenever you talk to a doctor and tell him you have higher cost in this operation, he understands that someone is reviewing the case with him and he's getting the lesson. And he's trying to just review his cases and take care of the consumables, and he will ask his nurse or he will ask the assistant team to take care of the consumables. Okay? So, this is a case study for one center having 4 branches in Saudi Arabia, and we managed to reduce the cost big time. And it was surprising. I couldn't say surprising, I would say it was shocking, really, when we showed them the figures. They understood, and their perception was that they are earning a lot of money, a lot of income, a lot of profit. After showing them the presentation, they were shocked that the most frequent they do the procedures, the more loss they have. Imagine, you have more patients, more procedures, you work more, you have high price, and you still lose money. They didn't have this insight. So any question regarding the previous one, the consumables? You know, guys, whenever you have consumables, medical consumables, it can really literally eat your income. So whenever the patient is admitted for operation and you think, okay, oh my God, the patient paid 20,000, 30,000, and finally, it ends with losses, this is really terrible for any business people working in private sector. And from my experience, it's not always the price. Price is one reason, okay, but most of the time is not the price. Most of the time is lack of costing systems, costing strategy. You know, when we have the costing strategy, we can track every item. We can track every activity, every procedure, every operation. Do we have income? Do we have profit out of the operation or not? Do you have profit out of the department or not? Okay, do we have how much profit from each doctor? Okay? And we have to include the indirect cost and the overhead. If you don't include the overhead, please don't take decisions. Because the overhead sometime, and maybe most of the time, is more than the direct cost. You understand? So I'll give you an example from here, from the ENT department in one of the centers having 4 branches in Saudi Arabia. It's the real case study. Okay, this center actually have 4 branches, as you see. Okay. Have 4 branches, as you see, Center 1, Center 2, Center 3, Center 4. Okay. So the revenue of the first center is 3.6 million. Let's take one line, 3.6 million, while the cost, I'm talking about the ENT department for 6 months also. Okay. So the revenue of the ENT department is 3.6 million, while the cost, the expenses, including the indirect cost and the overhead, of course, is 5.19. What's your opinion? It's lost 1.59. They never know this. And I'm telling you, most of the hospital and medical center never know this because they don't know, they don't have the strategy of ABC costing. They don't use any methodology for costing. So they totally misleaded by the direct cost. They don't have the indirect cost. They don't have the assignment of the overhead. And by the way, overhead is equal to indirect cost. Whenever we say indirect cost, it is the overhead, which couldn't be transferred easily and in a direct way to a procedure or a department or a doctor. This is what we do. So to be real, to have such kind of confirmed figures, it needs a lot of work, starting from having the methodology of costing. You have to know the methodology of costing that includes the indirect cost and absorb the indirect cost, okay? Fully absorption. Before, this multi-branched center or healthcare organization used to raise, to just appreciate the ENT department. Oh, they are making us, wow, good revenue, 3.6 million. Okay, so they don't know the costing because they don't know the indirect cost. When we started making the full absorption costing strategy, the ABC costing, we found out that they are already spending 5.19 million while the revenue is 3.6. So the loss is 1.59. And let's see, the OP census, the number of patients in the outpatient clinic is 9,000.6 or 0.7. So it's a big number already of patients. And 218 patients converted to have operations in the inpatient section. 207 having operation, and the total of the inpatient is 218. Okay, out of this is one of the branches. So look at all branches. The 4 branches are losing. The first one, 1.9. Look at the red figure. This is all about loss. So they have one department having loss, cross-sectional, horizontal losses consistently throughout the whole branches. It was shocking to them. And then they ask, okay, we have a lot of patients, we have good price, we have everything, we have high quality. Why we have lost by end of the year? Why we don't have cash flow? Because of this. You don't calculate. If you calculate, you can manage. Here is the point. When we show to them these kind of figures, they improve themselves in 3 months. What happened? What happened? Guys, what happened? Yes. So this is a slide of the overhead allocation, as you see. Center 1, Center 2, Center 3, Center 4. Let's go to Center 1 as an example. The total overhead, when I say overhead, is indirect cost, is throughout this medical center, all departments, the overhead is 89 millions for 6 months. For the whole center, not for the A&T department. Then we allocated 3% from this indirect cost, from this overhead to the A&T. The overhead, as you know, it is the indirect cost, as I said, and I repeat over and over because this is the most important. Okay, it includes the electricity, it includes the admin cost, it includes the finance cost, the HR cost, the CRP cost, the outsourcing services, the cleaning service, the laundry, everything is in this, included in this. The business trips, everything. Electricity, papers, what else? Okay. The consumables, general consumables, cleaning the wards, all of this is overhead, which make every hospital suffering if they don't have costing strategy. Okay, so from out of the 89 millions, we assigned the 3% to the NAT department. It's complicated equation and formula. We don't say 0.3% haphazardly. There are formulas and strategies to reach to this percentage, of course. So, for example, the first center, we gave them 3%. Okay, they shoulder 3% from the total overhead. The second center, 4%. The third center, 2.9%, based on the criteria and formula. The fourth center is 3.1%. So it become financially, it become 2.66 millions for the first center. Second center, 6 million, 0.3. Third center, 2.3, and fourth center, 3.2. For which department? Which department, doctor? A&T department. Let's double click it. Let's double click it, guys. So this is outpatient analysis for the E&T department for the 4 center. Center 1, Center 2, Center 3, Center 4. Let's go to Center 1, or let's go to the total, the first column, or the first group of columns. See the patient revenue in black. Let's go to the patient revenue. The total patient revenue is 283. Okay, so let's go to the total cost. This is the total revenue in black, and this is the total cost. So you have 200 plus total revenue, you have 300 plus cost. What do you expect? Of course, loss, okay? As you see, we make segregation, the cash business and the credit business, okay? And as you see, there is losses all over, either cash or credit. It's almost losing in all branches, okay? So they took action, actually, in some of the branches, they took action. Some of them found that they need to shift doctors from branch to another. And some of them thought, yes, guys, we use a lot of consumables. okay, and a lot of overhead in this department. We have to reduce it, okay, and they managed. Actually, 2 of the 3 hospitals until today, they managed to get good profit. The other 2 hospitals still developing their skills and their operations to just mitigate what happens here in losses. Okay, this is the value of having this costing matrix. Let's go to the inpatient part here. It's interesting as well. I don't like to take you guys to a lot of details. Let's look at the right part that may have some conclusion for the managerial members attending with us and the investors as well. This is how to make profit. So, as you see, there are also complete loss. This is a total loss, 4.5 million. From all hospitals, 4.5 million. Okay, for one operation called septoplasty. Septoplasty, here, you can see up the title, the septoplasty. It's a very commonly performed operation, the septoplasty, when you have blocked nose and things like that. You make septoplasty, and you can use also, somehow you can use the endoscopy technology in this. So there are loss 4.5 million. What if? Okay, then after having such kind of double-clicked analysis for one procedure, of course, as you see, we have all the segregation, all the item. I show you. These are all the items of the indirect cost, including the laboratory services, the pharmacy, and the nursing service, and so on and so on. It's all indirect. Okay? I have 2 minutes. No problem. Okay, so there are 2 suggestions. The first insight that we give to the management, number 1, what if analysis. What if we reduce the length of stay? LOS means length of stay. Of course, your doctor knows about it. Okay, so what if we reduce the length of stay from 3 days to 1 day, which makes sense to have 1 day admission for such kind of procedure. I don't understand really why doctors making the patient stay for 3 days. So if you reduce the days from 3 to 1, how much profit you will do? You will make a profit 2.4 millions. Instead of having lost 4.5, only you reduce 2 days length of stay. You don't need the patient to stay in the hospital too much. If he is okay, if he can go home. Okay, the second suggestion, what if we reduce the theater minutes from 143 minutes to 90 minutes, which makes sense based on the standards. You need to make the patient staying in the operation room for 90 minutes. So you need to just make the procedure faster without waiting. So if you reduce from 143 to the median, which is 90, then how much you're going to save here? How much profit you will get? Forget about saving, you will get profit after that. You will have 2.2 again, right? You will have 2.2. Total profit from one procedure. We're talking about millions instead of losses. Okay, so thank you very much for your active listening. And may I have space for one question, if anyone need to ask regarding this presentation or the previous one? If you don't ask, I will ask one question. Okay, that was interesting, a little bit? Okay, thank you very much. Thank you.